You mentioned concussion briefly there. We had a speaker on the show, I can't remember how many months ago now, talking about concussion, and I found it quite a surprise that concussion can occur outside impact in boxing or judo or rugby or whatever it might be, and she was saying that it can happen in whiplash situations and so on. Are you seeing more concussion patients? Are people more aware of the potential causes of concussion now, do you think?
A little bit, but I mean, just yesterday or Monday, a colleague, I was having lunch and he called me up, said, can you just have a chat with my patient? And he'd treated a couple of times for some neck and back issues, and as they were talking realised that there was something going on with a concussion that she'd had 3 years ago, and the doctors had not really taken it on board, and she didn't really understand any of the symptoms. So I had a 2 or 3 minute chat with her just about, are you feeling a lot of, where did we start? I think, you're getting a lot of brain fog. You find it difficult to concentrate. Has sleep changed? Do you find your heart's racing? The autonomic changes is what I'm looking at. So the areas that we tend to see affected with concussion are frontal areas where we have concentration, focus. The brainstem tends to go out of sync, so you get autonomic changes. And often you get problems with midline cerebellum, particularly if there has been an impact, because it's affecting the neck and the signals up from there to the cerebellum. So we see these areas.
Why specifically those areas, do you think? I'm sure there's no definitive answers to this.
There's research showing that like the frontal areas, when you get the contre-coup movements, the long tracts tend to get stretched and pulled. So that seems to affect the frontal areas. And there's something about the midbrain as well with the forces that go through, which I can't quite remember.
Okay.
So, but there were 5 or 6, there was a couple of good concussion papers back in sort of 14, 15 now. I think a chap called Ellis. They're probably a bit old now, but he was beginning to sort of segregate the types of concussions and whether it will likely respond well to some work on the neck and a bit of vestibular, or whether there's more frontal activity, or whether there's a lot of metabolic. Because it can be a very mild concussion, but the astrocytes, the microglial cells, then cause inflammation. And what should happen is that they turn off after a short period of time, but often they don't. And the people that have had concussion over sort of the 3-month period seem to have this constant activation of the microglial cells. So they're getting inflammation. So it's like having a bad flu all the time. Everything is harder to do.
I imagine if you went to your GP with those symptoms now, they would just say, well, it's a post-COVID thing or something, wouldn't they?
Very likely, yes.
Yeah. Or if you're a woman, it will be a hormonal thing.
Absolutely,
or if you're lucky, they might test you for B12 perhaps and say it's a B12 thing. I don't think many practitioners of any description think that concussion lasts that long. You said 3 years in the case of the patient that you saw recently.
If it's not getting better soon, then why will it get better in a while if nothing else is changing?
Yeah.
And
hasn't the assumption always been that it will naturally change?
Yes. And I think this is like so many things, isn't it? That you go to that particular practitioner for a bit and then realise that they say, oh, it will get better, and it's not, so you stop going. But then maybe they think, oh, the stats show that these people aren't coming back, so it's okay.
Yes, that is very likely the case, yes. I think, isn't it? Because let's face it, if you don't go back to your GP now, it's probably because you can't get an appointment. Doesn't mean you haven't got better. Yes.